Well, hey everybody, it's Sandy and welcome back to my channel dedicated to helping you advocate for your own health one topic at a time. So guys, today I want to talk about long COVID and whether it's all in your head or what my thoughts are on long COVID. It's poorly studied at this point. I think there are some centers around the country that are really trying to study this whole concept of long COVID, but I think it's going to be a while before we know what to do. And the genesis of this video, unfortunately, came at an interesting time because I recently did a video. Somebody had asked me about medical gaslighting, and I instead did a video that comprised a series of tips on how to function more profitably with your healthcare provider, because I thought that would be a little more helpful than talking about gaslighting. Even we kind of know this stuff exists, right? Blaming patients when we don't understand and when we don't know, and that kind of thing. So I got an article, a text message with a link to an article from a friend of mine talking about an association between depression type illnesses or anxiety and the risk of long COVID. And basically, it's no surprise that if you are depressed or you have anxiety issues, that your risk of long COVID is a little bit higher. That's not causation. This was just a study that looked at association, and that's a really important concept for people to keep straight, which is that association does not prove causation. Causation it's a very high bar to prove causation. So there's lots of things that are linked to other things, and they're not even necessarily related. There are some things that are linked to other things, and thing one is sort of a risk factor for thing two, but again, not causal. So there were a lot of problems with this article, and I don't want to get too down into the weeds of the article itself, but I just felt, I'm not sure what the intent of the person who sent it to me was, but it sort of bolsters this dismissing of people who complain about long COVID. And first of all, I don't want to dismiss that because I think long COVID is a real thing. I think we've seen enough in terms of not only the complaints that we hear from people, which is of course very subjective, things that are hard to measure like brain fog and whatever, but there are lots of physical complaints. We've seen autonomic dysfunction, heart dysfunction, myocardial damage. There have been imaging studies that show loss of brain matter, and those were causal because they were done in the form of a study that showed causation. There's imaging studies that look at the muscle of the heart and show damage. There's just enough out there that I know my good sense tells me that there is such a thing as long COVID. And so I don't want to dismiss it, but I don't like to dismiss people's complaints anyway. So let me start with that, and then I'm going to go on to what I think about this whole concept of long COVID so far. I think that there are all kinds of things that we know are risk factors for other things, right? How many times have you been like for your yearly physical and your doctor notices something and says, we're going to have to watch for this over the years, or this will put you at risk for that. So let's be careful about this and do some preventive things and whatever. That's kind of just part of preventive care. But for some reason, the causal, not, sorry, for some reason, when the underlying condition that's linked as a risk factor to something else in the future has to do with depression, there's a stigma there, right? And so then it's your fault, or it's all in your head, or something like that. So we know, for example, that there is a link between obesity and type 2 diabetes, and nobody disputes that. Nobody says that the diabetes is all in your head, and actually that link is more than just an association. There is causation, and so you can remove the underlying issue, which is the obesity, and you can actually reverse the type 2 diabetes. That's a whole other video. But if you said that depression was an underlying cause or was just associated with a higher risk of something else, somehow there's no credibility there. It changes the whole status of the person as a human being, and it changes the validity of whatever it is that they got, right? So come to find out that depression is actually a risk factor for all kinds of things, and that's no surprise, right? Because if you're depressed, that affects your immune system. Your mind and your body are very much connected. So it turns out depression is actually a risk for various cancers. Are we going to stop treating those cancers? Are we not going to? Are we going to question the validity of a cancer diagnosis if somebody happened to have been depressed? And is that causal? Is it not causal? Is it coincidence? Is it causal in everybody? I don't know. So I just have a real issue with this whole concept that because there's something that we don't quite understand and we haven't quite nailed it down, which by the way is because it's new. like long COVID, it's relatively new. And I think that's where the confusion comes in with sorting it out. But now we can say, oh, well, look, if you had an underlying, mental illness, then that puts you at a greater risk for that, which it does for many, many things. But now we can kind of question the validity of long COVID. So yeah, so that's out of the way now. Let me know what you think about that and be prolific in the comments section. So what do I think long COVID is? I think that we're going to come to the point where we find out that long COVID is actually an umbrella term for several different things. And maybe we're going to find out that one or two of these things is maybe not, it's maybe more coincidental, we might. But there are, in my opinion, or my prediction is that we're going to find that certain things under that umbrella are very real, and we are going to find a causal relationship at some point. And the reason I say that is because that there's enough physical evidence, like I just mentioned, where we have imaging studies that show myocardial damage, we have imaging studies that show gray matter shrinkage, and we actually have a small study, I've read at least one, I think two, recently, that looked at microclots as a causative issue underlying long COVID. And that one really resonates with me. So I can see this developing into something like an umbrella term where it can mean many different things. Now, microclots, I'll tell you why that resonates with me, because I think that might explain some of the ones that are hard to explain, like brain fog, things that are hard to measure, right? Brain fog, fatigue, and things like that, where you can't find an underlying physical manifestation. Just because we can't find it, by the way, doesn't mean it isn't there. And yes, it might be that some of these are not any different than they are in the population at large in terms of their incidence, or happen after other viruses and things like that. But I think microclots, it really resonates for a couple of reasons. Just anecdotally, I happen to know a couple of people who experienced COVID and got a form of long COVID in the form of headaches, really severe headaches that lasted for months. Now, one of these people, it finally seems to have ended, and it was like 3 or 4 months. And, I don't know, microclots. What are microclots? They're tiny little clots that can't present something like a deep vein thrombosis where an entire leg swells up because there's something in the way of getting the blood return back up to the heart of that extremity. Something's blocking it down in the deep vein. But microclots instead, they're too small to block deep veins, but they can block little capillaries. Well, what are capillaries? They're 1 cell thick, and the capillaries are the tiniest vessels that basically bridge the venous circulation and the arterial circulation, and the capillary is where the gas exchange takes place. So oxygen from fresh oxygenated blood is dropped off through the capillary to the organ, and the organ sends off deoxygenated blood or carbon dioxide through the capillary to go back to the heart and ultimately the lung for that blood to be reoxygenated. So the capillary is just 1 cell thick. It's a very, very tiny vessel, and microclots could certainly block capillaries. And in fact, we do know from autopsy reports of people who have died of COVID that they had micro blood clots all over the place, okay? Blood clots all over the brain. So, does this just kind of resonates with me? Could this be the manifestation of brain fog? Is there a significant proportion of these people that are actually experiencing microclots, and so that organ, the brain, isn't receiving as much oxygen as it needs quickly enough, and is struggling, or probably any other organs too. And now we can all make new capillaries. We have the ability to make new vessels, and that takes a few months. So when, I kind of wondered about it when my friend, had about a 3 or 4 month period where this started to go away. I thought, wow, that's about the time it would take to make some new collateral vessels. And not that those couldn't get plugged up too with microclots, but I guess the point is that if you have a certain number, let's say, of vessels, and a certain percentage of them are blocked with microclots, then the more you have, the less significant that percentage is. So this is all a lot of speculation out of deep ignorance, but suffice it to say, I was very intrigued by this concept of microclots, and that in the 2 small studies that I did read, that they were found circulating in people who had some of these complaints that are, we don't have any other way to measure, really. And I think that needs to be studied more. And again, I think that long COVID is ultimately going to evolve into an umbrella term that embraces several different conditions. And hopefully, at least for some of these conditions, we're going to find a way to address them and fix them. I've heard that there's some anecdotal reports that hyperbaric oxygen is working really well, and that kind of speaks to the microclots as well. Hyperbaric oxygen, really puts oxygen under pressure and forces oxygen through vessels. It also helps you make new vessels quicker. So um, I'm very hopeful about this, but I kind of don't want to hear any more of the, well, if you bring anxiety or a history of depression to the table, now it's kind of your fault, as opposed to other people, so it kind of makes you not want to seek treatment, right? If you have depression or some kind of mental illness, like, should you not get treated because, maybe you'll be blamed for your long COVID later? I don't think so, and I'm not recommending that. And certainly if you struggle with any kind of mental illness, I highly recommend that you get the appropriate treatment. Um, but I was just sad to see. I felt like that article, the authors of that article should have been very careful to go out of their way to underscore the fact that association and causation are two different things, and that in fact depression is a risk factor for many illnesses, both physical and other mental illnesses, and that doesn't make them not legitimate. And additionally, like I said in my previous video a little while back about functioning more profitably with your own healthcare provider, sometimes the dismissal is just a form of saying, I don't know, and I'm not comfortable saying that, or I'm not even aware that I need to say that. I don't know what's going on here. Let's try to figure it out. I think sometimes healthcare providers, sometimes we resent it when we don't know, and we feel like failures when we don't know, and then we react to our own feelings of being a failure. So the only thing you can do then is sort of either dismiss it or blame the patient. And I think that's a problem, and I don't think we're going to get anywhere with solving this long COVID problem, which I do think is going to be a bigger problem in a way than COVID itself. And I think we're going to have to put a lot of resources toward that. I wish that we would look at therapeutics more from that lens, and even future vaccines more from that lens. I think we've already ticked off the box of preventing death and severe disease. Okay, we've done that. At this point, I think that's a low bar. I think it's too low a bar. I think we have to start looking at preventing the morbidity that comes along with COVID, and not just the mortality, including long COVID. So that's my prediction. It's an umbrella term. We still have to get to the bottom of it. I'm very intrigued with some of the things like hyperbaric oxygen. I'm intrigued with whether nasal vaccines will prevent infection overall. Obviously, if you can prevent the infection, you can prevent the lung infection. And I'm cautiously optimistic. I wish we would put a little more resource to that. Anybody else notice that, the closer we get to elections, the more the whole pandemic is over and there's nothing to think about? And the reason for that and the rationale for saying the whole pandemic is over is, look, nobody's wearing masks anymore. Oh my God, don't even get me started. So yeah. Anyway, let me know what you guys think about this, and anybody who has had COVID and is suffering from long COVID, I'd really appreciate it if you put some of your thoughts down. First of all, how it's been received, or if you've noticed any things that help, doesn't help, and if you've noticed that some things went away with just a certain amount of time. I think that would be really helpful as well. So let me know, and until next time, be well. Bye-bye.